with the Cancer Policy Institute, the policy and advocacy arm of CSC. This roundtable is part of CSC's Forum on Utilization Management. Our Roundtable series is now in its fourth year. It was created to foster thoughtful discussions that engage a broad range of healthcare stakeholders and keep the focus on patients. Also to ask tough and nuanced questions about the appropriateness of various approaches and when they have the potential to harm patient health outcomes, and to identify new ideas and promising practices that optimize evidence-based healthcare. CSC is committed to fostering conversations that inform and engage all stakeholders in the creation and implementation of strategies that include the patient perspective and incentivize cost efficiency through improved patient care and outcomes. Before we begin, just a few housekeeping items. If you have any technical or administrative difficulties, please let us know by using the chat box at the bottom of the screen, and we'll do our best to address them. We'll have a question and answer session at the end of the speaker presentations. Please submit questions into the Q&A box throughout the presentation as you think of them, and we'll do our best to address as many as possible at the end of the presentations. I also want to take a moment to thank our sponsors: Amgen, Bristol Myers Squibb, Genentech, GSK, Janssen, Merck, Novartis, Pfizer, and Sanofi. Whether you are a patient, caregiver, patient advocate, payer, employer, or with industry, we are all here today to play our role in making healthcare accessible, available, and of high quality. We're honored to be joined today by three wonderful speakers who will address the health insurance appeals process from various perspectives. I'd like to start today's roundtable by introducing our first speaker, Monica Bryant. Monica is a cancer rights attorney, speaker, and author dedicated to improving access to quality information on healthcare-related issues. She's the co-founder and chief operating officer for Triage Cancer, a national nonprofit organization that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. Ms. Bryant is co-author of the first and only book on cancer rights law and is an adjunct law professor at the University of Illinois at Chicago School of Law, teaching a class on cancer rights. Throughout her career, she has provided more than 1,000 educational seminars for individuals who have been diagnosed with cancer, their caregivers, lawyers, advocates, healthcare professionals, elected officials, and the general public. Welcome, Monica. I'll turn it over to you.
Thank you so much, Kim. So I am delighted to be here to give a little bit of Health Insurance Appeals 101. So there are three places Americans get their health insurance. They get their insurance from a private health insurance company, like they go straight to the health insurance company and they purchase insurance, or maybe they're buying it through their state health insurance marketplaces. They get it through the government, primarily through Medicare and Medicaid, or they get their insurance from an employer. But regardless of where you get your insurance, chances are at some point in your life, you will experience a denial from that insurance. And I can say that with so much confidence because the data actually backs that up. We are seeing year after year increases in the number of claims that get denied. And when we look at percentages, it may not seem that significant, but when we start to look at the actual number of claims that are denied each day, it starts to really show the impact and the frequency at which people are experiencing denials from their health insurance companies. But the good news for us as consumers of healthcare is that we don't necessarily have to take that no for an answer. We have the opportunity to appeal that decision. If only it were as simple as that. There are actually multiple steps in the appeals process. And the very first step is to figure out the source of your health insurance. Where are you getting health insurance from? So did you go straight to an insurance company and purchase insurance? Do you get it through your employer? Are you a Medicare or Medicaid recipient? Do you have another type of coverage that I won't necessarily call insurance, because for many reasons they aren't necessarily health insurance. And this again seems pretty simple, but in reality it can be complicated. And here's an example of that. For individuals who are receiving their health insurance through an employer, there's actually two different types of plans, or two different ways that you can be getting insurance. So the first is what's referred to as funded, also known as insured. And this is where the employer goes to a health insurance company and purchases health insurance on behalf of their employees. The alternative is what's called a self-funded plan, also known as self-insured. And one of the reasons I think health insurance is so complicated is we often have situations where there are multiple terms for exactly the same thing. And here's an example of that. With self-funded plans, the employer is actually paying for the healthcare expenses of their employees directly. But this gets more complicated because in these self-funded situations where employers are paying directly for their employees' medical costs, they often hire a third party to administer the plan. So I often think of this as, who's the person that's dealing with the paperwork and writing the checks? That's that third party administrator. What's tricky though is that that third party administrator is often a health insurance company. And so here's a mock-up of a health insurance card that looks like every card I've ever had. There's some logo on it, there's a member name, a number, there's some phone numbers, and maybe some, dollar figures on there. Now, how does somebody figure out if they have a funded or self-funded employer plan? And it can be tricky because obviously not all cards are exactly the same. But in this situation, it's this cryptic language here at the bottom that says, BNSTAR provides claims processing only and assumes no financial risk for claims. So that cryptic statement is supposed to indicate to the employee that they in fact have a self-funded plan from their employer. It's just that BNSTAR is the third-party administrator. Now, I cannot tell you the number of people I have talked to over the years that say, oh, no way, my employer gets insurance from an insurance company. I don't have one of these types of plans. And then I suggest, call the number on the card and ask if you have a funded or self-funded plan. Ask whomever at your job deals with employee benefits. Is it an HR department or some other individual? And maybe do both of those things and make sure the answer matches. Because there are multiple rules that may apply differently to you depending on whether or not you have a funded or self-funded plan. And for today's purposes, those rules involve how you go about appealing a denial of care. So if we're talking about an individual plan that you've purchased maybe through your state's marketplace or directly from a health insurance company, or you have a funded employer or other group plan, there are generally going to be two levels of appeal. The first is an internal appeal. And this is essentially where you're going back to the insurance company and asking them to reconsider. Now, appeals can be done once you've received the service. So you've gotten the MRI and your insurance company has come back and said, we're not covering that. It can also happen even before you receive service. Like if you've gone to the insurance company and asked for a prior authorization and the insurance company says, we're not covering that. So appeals can happen at either stage in the process. When you're in the internal appeals phase, it is very important to follow the company's specific rules. There's always going to be timing requirements around when you file. You only have so much time to file that appeal. And then there's going to be rules about when the insurance company has to give you that answer. So if you've already received the service, the insurance company has to give you an answer within 60 days. But sometimes you actually need an answer faster than that. And that's particularly true when it's a denial for a prior authorization. So you haven't gotten the service you need yet, and you've been denied. In that case, if you can show that the delay in treatment is going to jeopardize your health or subject you to severe pain, you can actually ask for what's called an urgent or expedited appeal. And in those situations, the insurance company has to give you an answer within 72 hours. Now, in situations where someone has exhausted the internal appeal and they're still getting denied from their insurance company, they now have the opportunity to file something called an external appeal. Again, known by different names: external medical review, independent medical review, external appeal. But what's important to understand about this stage of the game is that you're going to an independent entity to get them to look at the facts and make a decision. Now, the decision of the external review is binding on you and the insurance company. So what they say is binding. And when I talk about appeals, I often feel like it's a easier said than done situation. But what I will say at this point of the game is that it is absolutely in somebody's best interests to try and appeal, because we know that somewhere between 40 and 60% of all appeals are decided in favor of the patient. So conservatively, we're talking about when insurance companies say no, half the time they're getting it wrong. So when we talk about financial toxicity and access to care, this appeals process is an incredibly important tool in our toolbox. There's timing with the external appeal as well. So generally speaking, you have to file within 4 months of receiving the final denial of your internal appeal. And typically, you do have to exhaust those internal appeals before you get to go to the external appeal. That being said, in those situations when the need for care is urgent and you're asking for that expedited appeal, you may actually be able to file the internal appeal urgently at the same time as the external appeal urgently and get those answers within 72 hours. Now, it's very similar, but an important difference when we're talking about a self-funded plan. There's still going to be that internal appeals phase, but now you're actually going back to your employer and asking them to reconsider the coverage. But it may not feel like that because you may be dealing with that third-party administrator I was talking about. There is also an external appeals opportunity with self-funded plans, but it's going to be a little bit different because of state and federal laws. And then with self-funded plans, you may also have the right to sue in court and receive some limited financial recovery in those situations. And I know I'm going over this really quickly, but I'm really just bringing both of these up to illustrate that step one of figuring out what type of plan you have is so crucial, because it is going to inform all of the other steps that you take. Now, just like with funded and individual plans, there are timing requirements with self-funded plans, so you're going to want to make sure to follow those to the best of your ability. Now, once you've figured out the process for appealing, step two is really understanding the reason that something was denied. And again, I think a lot of these denials come with some cryptic language that we have to decipher or translate as consumers, and it can be challenging. Sometimes it's administrative, like wrong coding. Sometimes it's about a service being considered experimental or investigational. And we see this a lot in the cancer community for off-label drug use or sometimes participation in clinical trials. It could also be that someone's not eligible for the benefit under their health plan. And we see this in cancer care. Maybe if someone needs access to a screening that is typically reserved for someone of a different gender or a different age category. It may also be that they're claiming it's not a covered benefit, like cosmetic surgery. But in cancer care, we do have some instances where certain cosmetic or reconstructive surgery wouldn't be classified as cosmetic. So these are all reasons why someone might receive a denial and have an opportunity to appeal that denial. So once we've understood the type of plan and the process and why it was denied, the next piece of the puzzle is gathering the evidence. And typically, this is something where I suggest patients and healthcare teams need to work together, because the evidence that needs to be gathered is that to show medical necessity, which is in fact the legal standard to a successful appeal. And so what's evidence of medical necessity? It can be any one of these things. So a letter from the doctor, it could be results of tests, it could be current studies that have come out. So why did the provider prescribe that drug off label? And it could certainly include medical records. Now, with the appeals process, there are multiple hurdles. One of those hurdles is actually accessing medical records. So if someone has received care across multiple hospital systems or over a number of years, accessing their medical records could actually be very challenging. Triage Cancer has what we refer to as a quick guide to accessing medical records that also includes some state-specific information about what you can be charged to access your medical records. Another hurdle is staying organized. This process is a lot. It's a lot for anybody. And now we're adding it on top of a cancer diagnosis and treatment and work and family and all the other things that somebody is dealing with. And so again, staying organized is sort of easier said than done. I do think it's imperative to keep track of any conversations you've had with providers, with the insurance company, with the third-party administrator, so that you have all of that information in one place. I often say the Post-it note method is a bad idea for note-taking in this scenario. Stay organized. We have a tracking form as one way to stay organized. I also think it's a great time to enlist the help of friends and family. Another hurdle we hear is peer review. So insurance companies can sometimes have healthcare professionals on staff, and then those healthcare professionals speak with the prescribing physician about why something was prescribed. Two challenges here are that sometimes this peer review they're held out like they are an external review when they really aren't. They're just another stage of an internal review. Another challenge is many times the doctors that are hired by insurance companies are not of the same specialty as the prescribing doctor. And so there can be sort of a knowledge gap there. And then finally, the last hurdle that I see with appeals is really about knowledge. Not enough consumers know that they have the right to appeal. And this is just data from the health insurance marketplaces in 2019. But we know that of all of the claims that were denied that year in the marketplace, less than 0.2% were ever appealed. So 99.8% of those denied claims were never appealed. And when you couple that statistic with the one I gave you about roughly 50% of all appeals are decided in favor of the patient, this gap in knowledge and people actually appealing is really concerning, and one way that we think we can start to really address the issue of financial toxicity and access to care. So I know I've gone over a lot in a short period of time, and in addition to all of the other great resources you're going to hear about today, please know that Triage Cancer has a plethora of free resources to learn more about health insurance and health insurance appeals. And I believe that Cancer Support Community is so kind and will share this with attendees after today's webinar. So thank you so much.
Thank you, Monica, for that very helpful and informative overview of the appeals process. I'd like to now introduce Mary Kwei. Mary Kwei is the Associate Commissioner for Market Regulation and Professional Licensing at the Maryland Insurance Administration, where she previously served for over 15 years as the Chief of Life and Health Complaints. She has been with the Maryland Insurance Administration for over 20 years. She also serves as the Chair of the Consumer Information Subgroup of the National Association of Insurance Commissioners. Mary is a graduate of Haverford College and the University of Maryland School of Law. Welcome, Mary.
Thank you. I am happy to be here. So I want to talk today about the role of the Department of Insurance in appeals, and specifically in external review, and what a Department of Insurance can do to help you. So first, what is a Department of Insurance? So states regulate insurance policies issued in the state and insurance companies doing business in the state. The agency that regulates insurance is generally referred to as a Department of Insurance, and the head of the agency is the insurance commissioner. Now, the specific name may be different in any given state. For example, I work for the Maryland Department of Insurance, but the name of the agency is the Maryland Insurance Administration. Departments of insurance enforce the laws of the state regarding insurance. And this includes health, which we're talking about today, but also life, auto, homeowners, and other types of insurance. A Department of Insurance will usually have different sections to review rates and forms, and that means approving policies before they're issued, examine financial statements and regulate the solvency of companies, investigate fraud, investigate business practices, and that's what we call market conduct or market regulation, and handle inquiries and complaints from members of the public. In general, states will have laws that address claim denials, require a process for appeals, and set up external reviews by the state for denials based on medical necessity and possibly other types of denials. And the specifics will vary by state. So I will be making general comments and occasionally referring to Maryland because that's what I'm most familiar with. Now, not all health plans are subject to state laws. And Monica did a great job of explaining self-funded plans. Other plans that are not subject to state laws include federal plans, federal employee benefit plans, Medicare, and Medicaid. So how can you find your state's Department of Insurance? Well, if you're online, you can search for your state's name and the phrase Department of Insurance or Insurance Commissioner. The NAIC at naic.org also has a list of state insurance departments and how to contact them. So in general, states will have informational materials and take complaints from the public, but details of how they handle complaints will vary. So what are some of the things they can do to help you? When an insurance company denies your claim or your request for authorization, the first step will be to file an appeal with the company. There may be assistance in your state available to help you file your appeal, and your state Department of Insurance can tell you where that is. In Maryland, it is the Office of the Attorney General. And they may also have educational brochures or videos on how to file an appeal. The consumer information subgroup I worked with put together a brochure for states to use that included a sample letter for filing an appeal or a sample template for filing an appeal. Okay, as Monica said, if your appeal is denied, the next step is external review. And the State Department of Insurance may conduct the external review if your plan is subject to state law. If your Department of Insurance conducts the external review for your plan, they may also be able to tell you if your case qualifies to be expedited or to skip the appeals process for care you haven't received yet. And in general, you have 4 months to file a complaint or a request for external review with the department. The Department of Insurance can explain laws in your state in detail and may be able to help you learn if your health plan has to follow those laws. They can help you read your insurance card or tell you if they know that your plan will not be subject to the laws of the state. States may also have mandates to cover certain benefits or limit the costs for certain benefits. And a mandate is a requirement that insurance companies require certain services. And for example, in Maryland, we have a law that limits the cost sharing, which would be your deductible or co-insurance, for oral chemotherapy to be comparable to other chemotherapy. So if you file an external review or a complaint with your Department of Insurance, what happens? Well, first we look to see if your plan is subject to state laws. And we may direct you to another state or tell you that you're in a self-funded plan. Second, we look at the reason for the denial, because denials based on medical necessity will be handled a bit differently from denials for other reasons under your policy. And that could be an exclusion or another limitation. Examples of denials based on medical necessity include denials for requests for an exception to the formulary. It could be because a service is experimental or investigational. Or the denial may say that you don't meet the criteria for a treatment to be medically necessary. If the state has jurisdiction, they will gather the necessary records, including records from the insurance company, and will probably send the complaint to an independent review organization, or IRO, for a decision on medical necessity. If the service is medically necessary, then the insurance company will have to cover it. If the complaint is about a denial that is not based on medical necessity, then they may look at state law mandates or other factors. As a regulator, a Department of Insurance may be able to impose a fine or conduct additional investigations into the insurance company's practices. I wanted to give you a couple of examples. So Elena's doctor has recommended a new medication that is not on the health plan's formulary and submits a request for prior authorization to cover the medication as an exception. The request is denied, and the denial says it's because the medication is considered experimental or investigational. Elena's doctor files an appeal, and that is again denied. And this time it says that the medication is unproven for Elena's condition, and it lists criteria for coverage that her condition does not meet. Elena files a complaint with the State Department of Insurance. Elena's health plan is subject to the state law, and this is considered a denial based on medical necessity. They have her sign a consent form for the release of her medical records and ask her doctor to provide the records. They also contact the insurance company to inform them of the complaint and to obtain the company's records and criteria to decide what is covered. And the company's records should include Elena's doctor's appeal and medical records submitted with the appeal. The Department of Insurance then sends the records to an independent review organization, which assigns a doctor in the appropriate specialty to review everything for medical necessity. In Maryland, the IRO also reviews whether the criteria are medically appropriate. And we have specific terminology in our statute about that. In Elena's case, the IRO decides that the criteria are out of date and not medically appropriate, and that the medication meets current generally accepted standards to be medically necessary for Elena's condition. The Department of Insurance requires the insurance company to revise its criteria and to cover the medication for Elena. Another example. Tom had a biopsy done as an outpatient at a hospital that is in his health plan's network. He received EOBs from his health plan, and they paid the hospital and physicians as in-network, and the providers billed him for his in-network deductible and coinsurance. However, the EOBs for the pathologist and laboratory showed that they were out of network. A portion of their charges was applied to his out-of-network deductible, and Tom received bills from the providers for their full charges. Tom contacted the Department of Insurance and said he chose an in-network hospital and had no control over where the samples were sent, and he didn't think he should have to pay his entire out-of-network deductible and their full charges. The Department of Insurance wrote to the insurance company and reviewed laws about surprise billing. The insurance company reprocessed the claims as in-network. Tom was told where he could file a complaint against the providers if they continued to bill him for the full amount. When the Department of Insurance received 2 more similar complaints against the insurance company, the Consumer Assistance Unit referred the matter to another unit to look at the insurance company's claims practices more generally. Another type of denial that comes up has to do with denials based on the codes used. And this can be confusing to people. Providers use codes on claims to describe the diagnosis and the services. A claim may be denied because the codes do not accurately describe the services that were provided. And even some providers can get confused about what's going on here. And many people will think that this has to do with whether the services were medically necessary. And it probably does not. But you can also still appeal these types of denials and file a complaint with your Department of Insurance. But you may also want to talk to your provider's office about whether the claim can be resubmitted with different codes. Now, in the examples I gave, the insurance department was able to help. And unfortunately, there will be cases where they cannot help because it's a self-funded plan or otherwise not subject to state law, or there is no violation. And the IRO says that the services were indeed not medically necessary in this case. But as Monica said, in an external review, and when you file a complaint about medical necessity, you have around a 50% chance of having the services be covered. And the people who staff departments of insurance have a great deal of knowledge, and they want to share it with you, and they want to help you, even if they cannot require the claim to be paid. They generally really want to help you understand your coverage. So please keep that in mind and reach out when you need help. Thank you.
Thank you, Mary. We appreciate you sharing that very helpful insight. Next, I'm pleased to introduce Aimee Hoch. Aimee is a master's level social worker with 20 plus years of experience in both healthcare and behavioral health. She earned her MSW from Fordham University Lincoln Center, a financial navigator for the oncology program at Grandview Health, and a financial navigation specialist for the cancer support community. She's an advocate for individuals diagnosed with cancer by meeting them with empathy and connecting them with resources to support them during their most vulnerable times. She is an active member of the Association of Community Cancer Centers Financial Advocacy Network Committee and a member of Cancer Support Community's Biosimilar Advocacy Board. Thank you for joining us today, Aimee, and we'll go to your first slide.
Great. Thank you so much, Kim. Thank you all for being here today, and thank you for having me. I am honored to bring the patient's perspective and to help everyone gain an understanding of where the patient is. So it's such an honor to be able to bring that perspective today. My hope is that everyone here gains an understanding of the patient's perspective, and I'm going to offer a different lens to look through when working with the patient and understanding where they are at the time where they present to you from whatever specialty you represent here today. This is the framework that I use in my financial navigation practice, and it helps us really understand what else the patient is dealing with. We know the appeals process can be extremely stressful and frustrating and probably shocking for our patients. And I think I should also mention that you're going to hear me use the term patients to describe the individuals that I work with. I work so heavily in the healthcare system that it just comes naturally to me. So if we could have the next slide, please, Kim. Thank you. You heard Monica mention financial toxicity. Financial toxicity is the patient level impact of the cost of cancer care. It's the measure of objective out-of-pocket costs as well as the subjective emotional distress associated with the high cost of cancer care and treatment. Even aside from someone going through an appeals process, most of the individuals that I work with are experiencing some type of financial toxicity and some level of financial distress related to their cancer care. And when we look at the whole entire picture of what they're experiencing, it's important to understand it could be that CAT scan copay. They just found out what their treatment regimen is going to be and how much that's going to cost. They need a certain procedure and there's a copay there, or they have this high out-of-pocket deductible. And then there's the other pieces that we find out after meeting the patient, that they they came to us with a limited income. So this diagnosis brings another level of financial distress and toxicity to their life. So next slide, please. So to start gaining an understanding of where the patient is, and again, wherever you're kind of meeting the patient, whatever department you're working for, organization, we know that they're still processing their diagnosis. They just got this diagnosis and now they're hearing that an important part of their care is not being approved and is being denied. Sometimes I spend my time helping the individual understand their health insurance plan. Many of us have health insurance. We don't really know when we're going to need it. It's very complex and complicated. So in addition to now hearing my treatment was denied, they're still in the beginning of understanding their health insurance plan to begin with. Assessing their support system is extremely important because we heard, what the appeals process entails. There's a lot of different steps, a lot of different pieces of information that the patient needs to find to support that letter that they're writing, the appeals process, finding out if that support person is somewhere within their family system, a friend, or it could be us. That is generally the primary role that I play as a financial navigator, is being a support system person for that individual, among other things that I'll discuss a little later. So again, understanding the level of financial distress and toxicity that they're already going through and what that they come to us already with, that is really important. Having an understanding about the treatment plan and the possible costs there. And then just having that understanding of the frustration, confusion, and stress related to the appeals process is helpful. Next slide, please. So I may be taking some of you back to a theory class or an intro to psych class, but this is a framework that I look through and have an understanding of where the patient is at. So in life, we generally at the top of the hierarchy, this is Maslow's hierarchy of needs. And it can really help us understand financial related distress related to cancer care. So in general in life, living our best life is being at the top of that hierarchy in the level of self-actualization. And that is when everything is going well and we're fully engaged in our life. So I'd like to invite you down further in the hierarchy. And when we see the orange level there, safety and security needs, that's where health is listed, employment, stability. And when we're thinking about someone having to go through an appeals process or experiencing financial toxicity or distress, they often are in that level. So if they're there, and we're talking about fully participating in their care is at the top level, they can't really get to that point if we don't address these issues in that orange level. I'd also like to invite you down to the physiological needs. And believe it or not, most of the individuals that I work with are also dealing with some of these other concerns in their life. It could be, and in fact, that's kind of how my practice in financial navigation started. As a social worker, I would have patients come to me and say, I'm either going to pay for my food, or I can pay for my copay and my cancer care, or pay for my mortgage, or pay for my cancer care. So we do also, our patients may not be expressing this to their physician or the person at the medical records department or at the insurance company, but these are often some of the other things that they're dealing with. So if they're operating and living down in those two lower levels of the hierarchy, they're not then able to participate in their care, their survivorship, attend all of their appointments. So it's really, really important, like Monica had mentioned, that we address this and move those statistics where more people have the information and feel empowered to be able to appeal any denials that they have. And we help them address the other financial distress that they're facing. Next slide, please. I also like to bring this to light. I find this in my practice that the silos are a great representation of what the patient is experiencing when they, after diagnosis, with their cancer diagnosis, they have their oncology team, they might be working with the business office, they have other services and tests that they need, they might have had an inpatient stay, they're having to contact their insurance company. And then there's all these wonderful outside organizations too that are helping them and working with them. But they're often dealing with everybody individually. So it's our role as advocates, navigators, maybe it's a case manager, a social worker at the hospital to help kind of liaison and bring these silos together to one for the patient. So just another area where when we're meeting with that patient to understand they're also dealing with this as well. Next slide, please. So what can we do to help? I think the most important piece we're coming from an advocate side is to let the patient know that there are options. I think that is very empowering. Mary and Monica went through the different steps and levels. And so it's really important for that person that didn't even know that they could appeal, that they can appeal. And these are some of the things as advocates and navigators that we might often help with. And we want the patient to know that they're not alone in this process. So to help them understand their insurance plan, like I mentioned before, I do this every day. A lot of people have their insurance, they don't anticipate needing it, right? But then one day they do need it. And just to understand that they can appeal, what their rights are, what their plan, how their plan is set up, what their deductible is, what the likely cost of treatment might be. To talk about all of that up front really lowers that financial toxicity and distress, just knowing that there are some options. So you want to help the patient understand what the reason for the appeal is, what information is needed. This is another area where an advocate or navigator may step in because you might help them get to medical records. You may be kind of a liaison between them and the physician's practice, getting information from there, helping them get some letters written. Again, I said help them understand that they have options, connecting to advocates and professionals. So if someone's coming to you and you happen to work in a business office at the hospital, and just asking, is there somebody else that is helping you with this? We're all out here, we all want to help, and we want our patients to know that we're available. And I love the tracker that Monica shared. My next thing is sometimes it's gathering information, organizing that information, making copies, helping them keep notes, record keeping, letter writing. So just all the paperwork involved can be extremely overwhelming. And it's a great place to step in and help if they don't have that family or friend support. Also stepping in and asking providers for needed information. That may be a role we find ourselves in. And lastly, the support and advocacy. Just being a support for them, like I mentioned, letting them know that they are not alone in this process and letting them know what's available to them is both empowering and, lets them know that they have somebody to walk alongside them during this whole process. So I thank you all for being here today and giving me the opportunity to bring this patient's voice to this discussion. Thank you so much.
Thank you, Aimee, for sharing that patient experience perspective. That's so important. We appreciate it. We have about 10 to 12 minutes for a Q&A session with our speakers. If you've not already done so, please submit questions in the Q&A box. So we do have some that have already been submitted, which I'll share at this time. The first is, if a treatment is recommended by medical guidelines, NCCN, NCI, Medical Association, etc., and that treatment is denied, can you just reference the guidelines? And a follow-up to that is, what if coverage is through an HMO like Kaiser Permanente? Open it to whichever speaker would like to take that first, and please others can join in as well.
Well, I'll jump in to just start very generally that guidelines are a great piece of the puzzle to speak to medical necessity, but they aren't necessarily going to be the only thing you can hang your hat on, because again, they are just guidelines and not necessarily requirements. But I'd love to know what Mary's perspective is.
I would say if you're filing an appeal or you're filing a complaint with the Department of Insurance, then it certainly helps to reference the guidelines. But like anything else, guidelines work with the facts. And you also have to show that, yes, these are the generally recognized guidelines, but here's how I meet them, because the guidelines will have certain criteria for when the service is covered. And as far as Kaiser, I'm in a state where Kaiser operates, and they are in multiple markets. And so it may depend a bit whether you're dealing with Medicaid or Medicare Advantage or the commercial market. The important thing is that you do file an appeal in writing, and that you say that you want the service covered and that it is medically necessary. And if you refer to the guidelines and to why you think it's medically necessary based on the medical records, then that's a great way to start.
Okay, thank you. Thank you for that. I have two questions that I believe go together, if I'm interpreting it correctly. So let me ask them both together. First part of it is, can you appeal more than once? You're the same person. They note here a different claim. I think the question means that possibly the same claim, but appeal more than once. And the second part to that is, when submitting a second appeal, asking to help cover payment, what are the chances of the payment becoming paid on that second attempt? I know, Monica, I'll just chime in. I know Monica added earlier that 40 to 60% of appeals are successful. If you get further down, not the first attempt, but beyond that, do those percentages change?
I think I just would want, sorry, lawyer answer, but I think I would want more information to be able to answer that. Why are there multiple claims? Is it for the same procedure at different times? Because then the facts, to Mary's point, are really gonna, I think, lead the answer to that. So yeah, I would want more information on that. So I would say, you're welcome to reach out to Triage Cancer and give us some more information. We can hopefully give you a more specific answer.
Thank you, appreciate it. And whoever put that question in, if they want to add additional facts in the Q&A, I'll be glad to circle back and try to give those additional details. Next question is, how can I find out about the resources in my state? And I know, Mary, you addressed that a little bit, but if somebody would like to take, all of you, if somebody would like to take that on and provide a little bit more first, second, third steps for people, that might be helpful.
To some degree, it's going to depend on the types of resources you're looking for. As I said, as a Department of Insurance, we can provide a lot of resources on state law and what applies to plans that are regulated by the state. If you have Medicare, SHIP is often a good resource, and that would be Senior Health Insurance Program, I think. But they are located sometimes within the Department of Aging and sometimes within the Department of Insurance, and they can assist with Medicare appeals and understanding coverage under Medicare.
And just to piggyback on that, I just dropped a link in the chat. Triage Cancer has compiled the contact information for the most widely used state resources for each state, including the Department of Insurance for every state's SHIP program, the legal aid in those agencies, in those states, because sometimes if we're talking about Medicaid, for example, there are certain legal aid organizations that actually can be helpful with Medicaid appeals. So that is, we hope, a little bit easier to navigate than just a Google search.
That's helpful. Thank you very much. Another question is, for expedited or emergency reviews, when does the 72-hour clock start ticking? Is it when the appeal is filed, or when the insurer/reviewer determines that they have what they feel is sufficient paperwork and evidence to begin the review? Maybe Mary to start on this one, but love to hear everybody's thoughts.
I would have to look at the technical wording of the statute about what it says. So Monica may have it at her fingertips better than I do.
So my understanding is it's when the appeal is received by the insurance company or the external review agency. So it's not, but you do have to complete, your appeal could be denied for an incomplete appeal. So if they don't have all of that paperwork, they could deny it based on that. But the clock starts ticking when the appeal is received.
Aimee, have you ever had questions like this from patients that you've spoken with, and had the opportunity to try to assist them in that timetable of making sure, I guess, especially really checking that box to make sure they've submitted everything that would be helpful for the reviewers to have versus having something done piecemeal, which may hold up or have a negative impact on the review.
Yes, definitely. As a navigator and really an advocate for the patient, we find out what that time frame is for whatever level of appeal that they're at, and really help them gather all that information so it can all be sent in timely, and we have all of it and understand what is needed. Definitely.
Great, thank you. We have a couple of more minutes. We don't have any additional questions put in the chat right now. I did hear back from the person who asked the one question about multiple appeals, and they just wanted to share that they did appeal before, and those that appeal did include letters from doctors, oncologists, dentists, surgeons, and other people, but it was denied. So any advice on, I guess this brings up too, at what point, does a patient and the provider have a conversation of maybe it's not going to be successful, and then begin discussions on alternate treatments? As hard a transition as that can be, if anybody can speak to that.
I think one thing to be aware of is that a treatment can be medically necessary, but also not covered under an insurance plan or under Medicare. Everything will have some exclusions, and some companies write policies with different exclusions than others. And so nobody is going to sit down and read their 132-page long insurance policy. But when you get a denial, it is very important to sit down and read the explanation of benefits and any other notice that you get. And then maybe you turn to your policy and see, is it an exclusion or is it based on medical necessity? Because if it's a complete exclusion, you are less likely to be able to get it covered unless there's some ambiguity about the exclusion.
Thank you, Mary. I think that's helpful. Appreciate that. One last question is any advice on signing a Medicare ABN?
I would just
Monica,
say
you're off.
yeah, I was just going to say there's no advice that occurs in vacuums, and so again, I think that we need more details about all of this. All of the situation, be able to answer that. But to Mary's point, I mean, I think that is such an important point about exclusion versus medically necessary. But I also want to remind everybody on today that thanks to the Affordable Care Act, we as consumers now have potentially multiple options for health insurance. And so if somebody's in a health insurance plan right now that is denying coverage for an ongoing treatment or care plan, feel empowered enough come open enrollment to look at what other options you might have available to you, because you can maybe make changes for the year ahead to find a plan that better fits your needs. So it doesn't solve all the problems, and it certainly isn't an immediate solution, but I think that sometimes gets left out of the conversation around appeals, in that you could potentially pick a different option for the year ahead that better meets your needs.
That's an excellent point and good advice to end on. We appreciate that. And there were one or two questions. Unfortunately, we're out of time, but we will try to answer them in a follow-up. So appreciate your patience on that. And we'd like to thank Monica, Mary, and Aimee for sharing their expertise with us today, and for providing an opportunity to discuss the important issue of insurance appeals. And thank you again to our Forum on Utilization Management sponsors, Amgen, Bristol Myers Squibb, Genentech, GSK, Janssen Oncology, Novartis, Merck, Pfizer, and Sanofi. And finally, thank you to all of our attendees for joining us today. Please reach out to the Cancer Policy Institute at action@cancersupportcommunity.org if you have any additional questions. Thank you and have a great day.